Guys, welcome back to Medical Coding with Blue. Today's episode is all about my review of the ICD-10-PCS Optum book 2023. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, if you are going to be taking the American Health Information Management Association, CCS, the Certified Coding Specialist, the gold standard of medical coding credentials, the CCA, the Certified Coding Associate, or if you are taking the CIC, the Certified Inpatient Coder, this video is for you. You can take any one of those exams with this book, okay? There's two versions of this book. The one that has a flat edge, you cannot use it. AHEMET has it on their do not use list. So you can use this spiral bound version, okay? If you are taking any one of those tests. So this is the book that you want to get. If you are with AHEMA and you are taking the CCS or the CCA, you can use this very book, the 2023 edition. We are in 2023. You can use this very book all the way until April of 2024. Okay, so just so you guys know, if you get this book, you can use it all the way to 2024. May of next year is when they roll over to their new exams. Okay, so just so you know, this is the book that you need. And so this is a wonderful book. I love Optum. This is not an ad for Optum, although I should be a walking billboard for them by now, right? We're going to start off with the table of contents. And then, of course, we have what's new. That's the first thing for 2023. Gives you a rundown of what is new and it like the changes and stuff. And then it talks about the introduction, the structure of PCS. And so this is really a good how-to about this whole book and understanding it better, right? And so that's the introduction. Talks about like body parts and approaches and things like that, placements and character meanings. So this is a really great book. I recommend that when you get this book, to take the time to actually look through it front to back. Now, you don't have to read everything, but at least take the time to flip through all the pages. The thing about becoming more confident when you take your test and picking up your speed and things like that. The thing about it is you have to show these books that you do not fear them. I know that sounds a little funny. But when I was studying for the CCS and knowing that this is a high stakes test, right? Because I had to get the certification. And there's many, many reasons that, I hadn't spent so many years not getting it because, why should I get it when I already have the CCA? But again, things are going on in the back. And so I needed to get the CCS. And I was determined more than ever to really study hard and really confront my fear of this PCS book. And so my way of confronting this fear was actually spending time with the book, which is what I recommend to all of you. Spend time with this book. Get to know the book. You don't have to tab it. You see mine is not tabbed. It does come with dividers from Optum. But again, I don't recommend them because they just get in the way. And when you are practicing with the book, when you're working with the book, you need this book to be as nimble as possible. So that way you can just flip through, get through it, and be done with whatever you need to get done with. Okay, so that's just my advice anyway. Now here it talks about the ICD-10 PCS index and tabular format. So it goes into more detail. If you are doing independent study, or maybe your instructor is not really teaching you, go back to the book, guys. Look at the book. Try to understand what's going on with the book. If you're struggling, find a mentor, somebody who can help you to learn it and explain it to you, or hire a tutor. There's lots of options out there, all right? Here's ICD-10-PCS additional features, talks about the table notations and some additional information, goes over all the appendices as well. And then here we have the ICD-10-PCS official guidelines for coding and reporting 2023. Now this goes over all of them. Obviously this is not as big. It's only 4 pages, well 8 front and back. But it's not as big and as intimidating as the ICD-10-CM, right? So this is a really good read, and I do recommend that you guys read this as frequently as you are reading the ICD-10-CM manual. I mean, the guidelines, because the more you are familiar with the guidelines, trust me, it is not a waste of your time. Now, here is the index, and I got just about to the right one, right page. But when we look at the index here, it's just these pages here, right? It's just these. Now, I recommend taking a Saturday as well, another Saturday, and just looking at all of the terms that you have available. Because in PCS, ICD-10-PCS, it is a lot different from CPT, right? CPT, the codes are already done. When you're looking up a removal is a removal is a removal. In PCS, it is something completely different. So take the time to just take a Saturday and look at all the terms. You don't have to read everything. But at least this is going to give your brain a primer. Your brain automatically records everything that goes on around it. You ever have that moment of like, I know I saw that somewhere. I remember seeing it somewhere. That's exactly what's going to happen when you do this. When you take a Saturday to just look at all of these terms and see all these terms that are available. And it's just in the index section. Just take the time to look at it. Again, it's giving your brain a primer so that it can learn, okay, we are learning to absorb all of these things in. You don't have to memorize this stuff. Just look at it. Just look at it. It is a mindless activity to just look at things sometimes, you know. But this will really help you to start understanding those terms, and they're going to become more familiar, and you're going to be able to recognize them. You may not understand it at first, but you will start to say, oh, I know that there's a destruction category, or there's a category for drainage, and you can start to get more proficient with PCS this way, all right? And this is just a very simple act. There's no apps. There's no weird trick. It's actually just looking at the book, okay? And so doing so is going to give you a lot of practice, all right? And then, of course, we get into the tabular section, right? The ICD-10-PCS tables. And it starts off with the central nervous system and cranial nerves. So wonderful illustrations throughout. This is a great thing for medical coders. It's very important to know your anatomy, but it's also a great backup when you know you have these available, because you can take your books in with you when you're sitting for the CCS, the CCA, the CCSP, or the CPC, right? But again, this book is for the CCS, the CCA, or the CIC, okay? So none of the other ones. But look at this, guys. See where the table starts off at, and then of course you have your body part, your approach, your device, and then your qualifier. But I will show you guys this, right? It's been acting funny, so I'm not going to creep forward. But of course, I know you can see that there's a line here. You know, whenever you're looking up a code, that's your start, the start of your code, those three numbers, the numbers and letters, and then the body part, the approach, the device, the qualifier. You can only go across the same line. If you have up here and then you try to go here, that's wrong, okay? You can't do that. You can't jump lines. You have to go across the same line. So if what you're looking up, it doesn't fit across here some way, then you have to look at the next category and see if maybe there's a better fit, all right? So just something you guys ought to know. I used to get confused with that. I was like, what? But yes, it goes all through here. And they say, and see, this is a really good example because the other one was kind of long. But you see how it goes across here, and then this is another line goes across here. It goes across here. Again, you can only go across. You cannot go all these other lanes, okay? You have to stay in your lane. So again, that's where it starts, those three. And then you have to choose your body part, your approach, your device, and your qualifier, okay? Easy as pie, right? But again, it's great practice when you start working with it, okay? And then it goes throughout like all the sections, okay? All the tab sections here. And it'll give you like the location right there at the edge, and it changes color every time. It changes the chapter. Again, more beautiful illustrations, and it's already highlighted. I didn't highlight this. It's already highlighted in the book. So there's your key at the bottom of the book. Hopefully my finger's in the screen. Yes. So there you go. There's all that. So it's just a matter of getting practice with it. It doesn't need to be written in, guys. I know that there's a lot of people that, well, you know, I can write my notes. You won't have time for notes, guys. You won't have time to review your notes because all of these tests are timed. It is very quick, and by the time you know it, it's over. And you just have time basically to get in there and just go. With the American Health Information Management Association, the CCA and the CCS, is about 2 minutes roughly per question. Now, I don't know how many questions are on the CIC, you know, and I don't know how long that exam is, but I know for a HEMA, it's roughly 2 minutes per question. So that's just something that you all ought to know, okay? When it comes to these tests, you have to be so proficient with these books, and that's what's going to help you to get through confidently, because that's the goal, right? Is to get through as confidently as you can. So let me go ahead and skip all of this sections here, because I'm sure you guys get the general understanding of, you know, all of the sections, and it breaks down. It gets very, very, like, down to the very good detail in here. But I really want to talk about the appendixes, because the appendixes is really my favorite part of this whole book, is the appendixes, because of all of the great information that it has in it. So let's get to Appendix A. Okay, so components of medical and surgical approach definitions. So it talks about what open, percutaneous, endoscopic, natural or artificial opening, all of these, it talks about it. It talks about access locations, method, type of instrumentation, and it gives you examples. So if you're ever wondering, what does it mean if they say that the patient is having a percutaneous endoscopic procedure, right, or like approach, you know that an example of that would be an arthroscopy, a laparoscopic, or a cholecystectomy, laparoscopic cholecystectomy. So those are the types of procedures that have that kind of approach. If they talk about via natural or artificial opening, that's endotracheal tube insertion or a Foley catheter placement. So those are the types of things that it talks about here in Appendix A. When we get to Appendix B, we talk about root operation definitions. So it gives you all of these. It lets you know what does reattachment mean. It gives you the definition. It lets you know what MAP means. So everything is back here, guys. The appendixes in the Optum book are fantastic. You can learn so much by reviewing the appendixes, okay? And then we have Appendix C, which is comparison of medical and surgical root operations, right? We have that. And then we have Appendix D, the body part key. I really like this one because it gives you those, like the term, and it gives you the ICD-10-PCS value. So what that means is if the doctor documents anterior spinal artery, right? In the ICD-10-PCS translation of it, right? That would be, I said this one, didn't I? Yeah. Anterior spinal artery. The ICD-10-PCS equivalent value would be vertebral artery right or vertebral artery left. Or vertebral, however you say it, right? So that's the thing. This is just like a interpretation guide for the body part key. Angular vein, that would be face vein right or face vein left. And it's just different ones. I mean, you have a whole thing. When they have a gluteal vein, hypogastric vein right, hypogastric vein left, right? So there's a lot of the hallux, right? In PCS, it would not be hallux. It would be first toe right, first toe left, right? So that makes sense, right? It's fun when you get into it, but that's the nerd in me. So that's the Appendix D key. A great read on a Saturday or just in the afternoon when you feel like studying and you're just like, let me check out this. This is a great review, okay? Then we have body part definitions. What does it mean? So the abdominal aorta includes, right? It doesn't mean like meaning definition wise, but it's like, what does this include? Is what I meant to say. Abdominal aorta includes inferior phrenic artery, lumbar artery, median sacral artery, middle suprarenal artery, ovarian artery, testicular artery. These are all abdominal aorta, right? That's the definition. The abducens nerve is the sixth cranial nerve, right? And that's what that includes. So this is just saying what all of that includes. The acoustic nerve includes the cochlear nerve, the eighth cranial nerve, the spiral ganglion, the vestibular nerve. So I just kind of skipped over ones because you guys get it, right? So this is what the body part definitions, what is included in certain terms. All right. So it's just another fascinating read. I love their appendixes. It really takes so little to make me happy. I'm such a nerd. So then we have device classification. So this is another thing that you all really got to know and pay attention to. The thing that I love is having providers who have their own YouTube channels, or they're really popular on LinkedIn and things like that. Two very awesome doctors who I personally enjoy listening to. I like what they have to say. Dr. John Lynn, who is a urologist, he actually does shows on YouTube about like different equipment that they use in urology surgeries, which I think is fantastic, because if you code for urology, what is better than knowing and actually seeing even his review of a particular instrument? At least you understand what it means when you're reading it, right? When you're reading it in these surgical notes, even when you're reading them in their progress notes, it's nice to understand what it means. It's a really good thing when coders stretch their minds to think, what is this? And then they go and they look it up and they find out, and they're able to really understand more. When I started reading the New England Journal of Medicine, and I started to understand, yes, some of the stuff goes over my head, and I will admit it, but there's a lot more things that I understand now because I gave myself that opportunity to learn something different. And it's not just trying to learn the codes, even though, yes, that's a big part of what we do, but it's also an even bigger part to understand what they're talking about. Dr. Antonio Webb is another one. He is an orthopedic spine surgeon, and he is amazing. He has a very big presence on LinkedIn. He also has a YouTube channel as well. I will link both of their channels, and both of them talk about the equipment that they use. Dr. Webb talks about, what it's like to be a surgeon too, and knowing, and see that other part too, knowing how these surgeons are as people, and not just, I'm a surgeon, understanding them and what makes them tick is such an eye-opening thing, and it does help you to improve your communication. Two birds with one stone, y'all. Really. I know, but it's a great way to learn more, okay? And it all starts with learning about those little things, about like the equipment, taking the time to watch these other doctors and their channels, so that way you can pick that stuff up. I think it's great, and that's what I would recommend anyway. So we have device classifications, implants, and then some examples of implants, and to like better help you understand graphs, the definition, what is it? And then it gives you examples of like what a graft is, right? You have autologous, you have non-autologous, you have synthetic, and you have zooplastic. Okay, these are all the different types of grafts that they have. Okay. Appendix G is the device key and aggregation table. So this talks about the different devices, right? And then it says what the ICD-10-PCS value is. So if we're looking at something like this AFX endovascular AAA system, in here in the ICD-10-PCS value, that's an interluminal device. Okay, so when you're looking up codes and they happen to write this in their documentation, you can come back here and look it up and find out that it's an interluminal device. You don't have to go and search and do all this Google and stuff. Okay, I'm checking the time, making sure I'm not running out of time. But yes, you have like mesh, and then it says it's a synthetic substitute. This particular one, Bard Dulex Mesh, is a synthetic substitute. So again, this is a very helpful table back here. I know I need to speed it up because I'm almost out of time. Then we have Appendix H for device definitions. This is telling you what these devices are, right? An external fixation device, monoplanar, for reposition in lower bones. It includes uniplanar external fixator, right? So that's what those includes. They're in their definition. Remember, like the last time. So let's see, H, and then we have I, which is the substance key and substance definitions. Okay, there's enough on there. You guys get that. So we have, and then we have Appendix J, right? That talks about physical rehab and diagnostic audiology, right? We have that, and we have Appendix K. This is hospital-acquired conditions. Okay, so if you code on the inpatient side, this is very important. These are all the procedures that would go with like hospital-acquired conditions. Got to be real careful about those, all right? Let's see. K, L, and L is, looks like it is for procedure combination tables. Yeah. Procedure combination tables. Okay. Procedure combination tables here. Very good. Very good to read. And a very good review. All right. And then we have, I'm going to make sure I don't skip anything. All right. Okay, so then we have my most favorite. And this is going to be your secret way to really learn. This is Appendix M, coding exercises and answers. So what they did was they changed it. It ends with Appendix M this year. Before, it used to be into two separate appendixes. Now this Appendix M is the last appendix in this book, right? There's nothing else. There used to be an Appendix N like in Nancy with all the answers, but what they did was they just split it up. So here's the start of the quiz, right? Work through all of these, guys. You want to learn this book? You work through all of these. Work them, every last one of them. There are hundreds of procedures here. And I'm telling you, when you've worked through all of these, this will give you a complete rundown of everything in this book. All the chapters are covered. The medicine chapter, osteopathic, nuclear medicine, radiation, chiropractic, imaging, all of those. Everything. New technology, and then all of your answers. So then you can check your answers. And if for some, it gives you some rationale as well. It'll give you the answer and it'll give you the rationale. But that's a fantastic way to learn the ICD-10-PCS book. And that was how I learned it. I did all of those in the back. And that was how I knew I was confident enough to sit for that exam, for the CCS. And I passed on the first try. So I want you guys to take a lesson. It's just about going through the book. It's just about connecting with the book and working through all of those. When you work through them and not work through some of them, not work through half of that last Appendix M, you work through everything. You want to pass that test? You want to get out and get a good job? That's the way you learn. That's the way you learn. And you keep confronting that fear. If you have that fear, if you get that frustration, it's okay. We all went through it. But it's not about how many times you get knocked down, guys. It's about how many times you get back up. And you will get there to understanding it. But you have to give yourself that opportunity. And work through those appendixes. And trust me, this book will no longer be a formidable opponent. It will be your friend. You'll understand it better. So, with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. I really had fun on this episode. But I'm talking about books, so what do you expect? Anyway, if this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye!